As we have been reporting this week, an inflammatory disease in children that is linked to COVID-19 has surfaced in northeast Iowa.
Now, children with that PMIS, or as people have been calling it, are popping up with that rare syndrome in Iowa. A couple of cases that we know of. And KWWL reporter Ashley Neighbor talking today to a doctor and a Lynn County family whose child was diagnosed with that rare illness. She has some of the details.
8-year-old Fortune Djagni was discharged today after spending 9 days at UnityPoint Hospital. His doctor tells me he was the first patient here in Iowa to be diagnosed with the syndrome. After getting cheered on by hospital staff here at UnityPoint, the Djagni family is ready to head home.
Celebrate that I'm feeling better.
Fortune's doctor, a pediatric cardiologist, says the syndrome seems to be the immune system's reaction to post-infection of coronavirus.
He has had this coronavirus infection at around 5.5 weeks before this illness.
The family felt slightly ill in February, losing their taste and smell, but Fortune barely showed symptoms. It wasn't until early May when he started acting lethargic.
He was very
Weak.
Yeah, when he was sick, he was, you don't know what to think.
Dr. Boutel says it's a rare syndrome, but says parents should look for a 24-hour fever, as well as
your child is having abdominal symptoms like vomiting and diarrhea, or having generalized rash or any kind of rash, having pink eyes or red eyes, and some respiratory symptoms, delirious, lethargic, tired.
Fortune responded well to treatment. It's now been 2 weeks since symptoms first appeared.
Your body is inflamed, multi-organs are affected. What you need is to suppress that inflammation, the swelling. Then we use the medication to suppress the inflammation, and he responded to that.
Fortune says he's
Excited
to finally be feeling better, and Dr. Boutel warns,
let's be aware but not panic. This condition is still rare, and the common childhood illnesses are way more common than this condition. And when this happens, when we treat early, they respond very well.
While it is rare, Dr. Boutel says to avoid getting it, children should avoid getting the coronavirus. So he recommends following social distancing guidelines. Reporting in the Cedar Rapids newsroom, Ashley Neighbor, News 7 KWWL.
Ashley, thanks very much. Best wishes to Fortune. By the way, Fortune's parents, interestingly, they first reported that they weren't feeling well back in late February. However, their loss of taste and smell at that time, remember, was not listed as a symptom. So they did not think that they had the coronavirus. However, we're happy to tell you tonight the entire family has recovered.